This is going to be a demonstration of a seated occipital lift. So this would typically be done for a COC1 restriction, lateral flexion, coupled lateral flexion, rotation, anterior sagittal glide. There's a variety of different ways to do this. I'm going to demonstrate the method where the patient is placed on the chest. All right. So just by way of review real quick, the assessment would be to retract the cervical spine, ipsilaterally bend it, a little bit of rotation back to the midline, and then apply overpressure from the top and get a sense of what that feels like. And then do the same thing in the opposite direction, so lateral flexion isolated to the top, rotation just back to the midline, get that nose back to the midline, and then some overpressure. All right, you're a little bit stiff in both directions. This direction is a little stiffer, however, so this is how we're going to set it up in this manner. Left lateral flexion, right rotation. So I'm going to just swivel you on the chair a little bit. All right, keep your feet flat on the ground, right? So the contact is going to be the middle finger right underneath the occiput, all right? And it looks like that. Middle finger right underneath the occiput. The ear, if you open your hand up, the ear will go in that thumb index web. So it almost always works out that way. And that puts your middle finger in the sweet spot for where this adjustment works best. And your thenar is resting on the mandible, but your fingers are on the occiput and the cervical spine. Everything's in contact, and that'll eliminate any pressure on the mandible when you set this up. So there's your contact. There's your initial preload, just that left lateral flexion right there, right? And then once you get that left lateral flexion in, you add the rotation in, right? And there's the rotation right there, all right? So there's your preload. At this point, you place your chest, the doctor's chest, parallel to where the head and neck are, and you bend your knees a little bit, and you just place your patient against your upper chest, all right? Is that position okay for you?
Yeah.
Is the mic hitting you on the side of the head at all?
No.
You're okay? And then you reinforce the entire contact, not the finger, but the entire contact you reinforce. And you bring your elbows out and you get nice and relaxed, all right? So you're loose, the preload's already there, your arms are relaxed. And the force generation for this really comes from your legs. You do connect the patient to you. You connect the patient to you with your hands, but you're not really thrusting into your chest. You're not like doing that. But you are, I'm going to go ahead and perform this, you are lifting with your legs like that. And that's how that adjustment is done best. All right. Force generation from the legs. Thanks very much.
Absolutely.
All right. That's a wrap. All right.